Hi, this is Tim from Chiro, and today I wanted to talk to you a little bit about the differentiation of axillary neuropathy from a shoulder impingement or a cervical radiculopathy. A couple of months ago, I had a patient who came in and he had a vague radiating numbness and paresthesia down into the deltoid area, just kind of a dull aching in the shoulder and a little bit of weakness and fatigue with overhead activity. And I initially diagnosed him with his cervical radiculopathy, and I thought there was probably some impingement. And as it turned out, I was wrong, that I was missing something called quadrangular space syndrome. So quadrangular space syndrome involves the axillary nerve. The axillary nerve originates from C5 and 6. It travels then anterior to the subscapularis and then exits the axilla through the quadrangular space. It's bordered on top by the teres minor and on the bottom by the teres major. Its medial border is the triceps and the lateral border the humerus. The axillary nerve innervates the deltoid and the teres minor muscles, and so this nerve is irritated through either compression or traction. A lot of times this is a young athlete, especially somebody who's overhead athlete. Sometimes it happens through trauma or carrying a heavy backpack, but what oftentimes happens is through repetitive use, one of the teres muscles, especially the teres minor, develops a fibrotic border that then cuts into that quadrangular space and cuts into the axillary nerve, causing an ischemia. And especially when that nerve is placed in a position of traction, that ischemia is provoked. So the way that we differentiate these two is that a quadrangular space patient often has tenderness at the quadrangular space. We call that the quadrangular space sign. Their symptoms are provoked in the late cocking phase when they're getting a traction ischemia. And sometimes if the problem's been around long enough, there'll be weakness in abduction because the deltoid is becoming weak, or weakness in external rotation when we test it resisted because the teres minor is becoming weak. So what do we do for this patient differently? Well, we're certainly going to address any cervical or shoulder components that are there, but for the axillary nerve itself, it's a slow healing process that a lot of times this is going to take a few months. It's going to take some rest. It's going to take changing the mechanics of the way that the patient throws to avoid prolonged traction of that area. We're also going to want to make sure that we do myofascial release and stretching exercises to the muscles and tissues that border the quadrangular space. And we're going to give that patient a home program to strengthen those muscles and try to avoid prolonged traction of that area. With a little bit of patience and recognizing the problem, we can usually make a big difference in these patients' lives. I hope that was helpful. If you'd like more information about quadrangular space syndrome, check out the Chiro protocol, and we look forward to talking again in the future.